Hi, I'm Dr. Warwick, your local Lacey Olympia chiropractor, and I'm doing a demonstration or showing you how the lumbar flexion distraction table works. So people that have maybe low back pain, SI pain, sciatica, or involvement with their disc area in their lower back is a great way to help traction and open up that area to allow for better movement and function in there, and ultimately giving some relief in there. So you notice the table here is tractioning his spine in just a straight up and down type motion on the lower portion of the body. The patient usually positions themselves at a certain point in there that creates that traction across there. Sometimes they even adjust themselves on there to get a little bit more of a stretch on there. He's been stretching for a while before I actually turn this on, so I'm going to show you, excuse me, Bill. I'm going to show you what it's like when we start moving it a little back and forth right here. So right now I'm making contact with the two SI joints in his lower back, just to get a nice little stretch between there. His right one was bothering him. In fact, the whole entire muscle group, all 8 layers of his back onto the right side, was causing a spasm and the pain up to what we call the paraspinals right here into his back. But it's originating right down here, and a lot of that time it's because we're getting compensation. He's on his feet all day. He runs a very successful restaurant, Adriatic Grill, in Tacoma, Washington. So great food there, by the way. You doing okay?
Mm-hmm.
So right now I'm moving into the lumbar spine. I'm just holding pressure onto the disc spaces right here, and I'm just doing a very, what we call a side-to-side motion. We call it lateral flexion. And by holding that, as that table goes in that furthest position away, he gets a nice deep traction throughout that area. And you can essentially, the chiropractor can essentially do this up the entire spine. I try to concentrate on his down into the lower back, at the 5 vertebrae down there, and the sacrum and 2 SI joints right there. And sometimes I could bring and work up some of the paraspinals on one side or the other, even bringing the head position a little bit forward of a motion so he gets more of a traction on this area right through here. You doing all right?
Mm-hmm.
All right, very good. Now, I usually do that for approximately 5-8 minutes on there, not too much. You have to gauge it with each patient to see how they respond, because sometimes if their body's not used to moving like that, you have to get a feel for what's going on and then get feedback from them and see how they're doing, because a lot of times you can push them a little bit too far. So it's something that you do over time and comes up with a little bit of experience in working with it. All right. And there you have it. I'm Dr. David Warwick, your local Lacey Olympia chiropractor.